Okay, this is a continuation of pediatric developmental milestones / expected versus abnormal findings for HESI, ATI, or NCLEX-RN, or NCLEX-LPN. So this is what we're going to start off with. These are kind of the expected changes that you would see. So in the previous lecture, I already talked about those different developmental milestones that they need to meet. They need to meet by at least 18 months. So now we're going to be talking about fontanelles, right? This is going to be coming up, especially when you're looking to see if the fontanelle is closed, whether it could be because of dehydration or increased intracranial pressure. So you have two fontanelles, not you, but the baby has two fontanelles. One is the posterior fontanelle and the other one is the anterior fontanelle. Anterior one, just like what the name, anterior, it's in the front, and posterior one is going to be the back. The anterior one is going to generally close by 18 months. So by the time they hit the 18-month mark, this front fontanelle is going to close, okay? And by the way, fontanelles are really soft spots where the skull usually does not completely meet, okay? This is what we would consider those suture lines. If you've ever seen a picture of the skull of the and you will see that they have these like little demarcations, these little almost, they look like cracks, right? But they're usually not completely closed when the newborn is born. And the reason why they have these fontanelles where it's not completely closed is because it allows the baby's head to be able to get out of the birth canal, because at that point the skulls can sort of overlap. If they're not completely closed, then it allows the baby a lot easier for it to come out of the birth canal. So you have this anterior fontanelle right here and this posterior fontanelle. These are also known as soft spots. And the first one that closes is the posterior one, actually. The posterior fontanelle closes at 2 months, and then the anterior fontanelle should close by 18 months. If they do not close, this is concerning, okay? And usually up until the 18-month mark, we can really monitor the fontanelles to see what's going on, to see if there's any sort of change in condition with the newborn. So if you have fontanelles that are more sunken, that usually indicates severe dehydration. And if you're a bulging fontanelle, meaning those fontanelles are more raised, that usually indicates increased intracranial pressure or increased ICP. So what you will see on here is the posterior fontanelle and the anterior fontanelle that you have right here. Second thing we want to talk about is teeth, right? So primary teeth all starts coming in between 6 to 12 months. And usually we have teething toys that are super helpful to sort of relieve the discomfort and the pain that's associated with this. And a lot of times when teeth are starting to come in, babies can be very irritable. It can be painful for them. So teething toys are super beneficial to sort of help with the irritation and the pain sometimes as well. And now for medications, okay, if babies are teething, okay, can we give them medications? Well, usually medications that can be given are Tylenol or ibuprofen. Yes, these can be given if it seems like they're in a lot more pain. These medications can be given. There's some gels that you can put on there too, so they're called teething gels, and they can be sort of rubbed onto the gums to sort of help provide more short-term pain relief as well. And that can be very comforting as well. Food. So this is another category on what to give and what not to give. So again, we don't give honey to infant or to babies younger than age 1. Okay, younger than age 1, we do not give honey because of botulinum toxicity. No whole grapes. Remember, choking hazard. Okay, so chopping up the grapes are okay, but nothing, no big round things that they can choke on. Cow's milk, usually 12 months and above, is okay to give. And remember also, don't give them too much milk. Also try to give them foods, especially foods that have iron in them, because what happens is that if you're just giving them milk, remember, it can lead to iron deficiency anemia. That is another test question that I've seen a lot of times. So giving them too much milk can actually lead to iron deficiency anemia. So remember, starting at 6 months, remember, they can also start on solid foods. So at that point, you want to make sure that they're getting enough iron intake, because remember, after about 6 months or so, you start seeing iron deficiency anemia. And the reason why you don't see it in the first 6 months is because you usually have iron stored from mom that they have received when they were in utero. So there's enough iron stores available for the first 6 months. But usually after that, you start to see potential iron deficiency anemia and things like that setting in. All right, so here is a question, and this is a safety question. Oftentimes, NCLEX likes to test you a lot on safety, ATI and HESI as well, okay? You're educating a group of parents about car seat safety. A participant asks about the best position of a car seat for a 6-month-old. Your response is what? So I'm going to go ahead and give you guys a chance to sort of look over the question yourself, and then you can go ahead and tell me what the answer is. So this is a safety question. Oftentimes, that's another big thing too with NCLEX, right? Or with ATI or HESI. They always like to ask those safety questions, okay? They like to say, hey, does this individual, this future nurse, do they know what are the big safety concerns that they should be looking out for? And that's what you're going to be looking at, okay? So right on here, what would be the most ideal position that we can put this 6-month-old into? Okay, let me give you guys a second. Okay, the answer is going to be rear facing and back seat. This is the correct answer. Okay, rear seating and back seat. So that is the ideal position we should be in, remember. And if I know some of us are visual learners, so I'm going to go ahead and share a picture. Back seat, we know that they're obviously not going to be in the front seat. And this is how a back seat, this is how it should look like. So if you have, and you know, if you have that kind of image in your mind, it oftentimes is helpful to remember what that sort of looks like. So this is rear seating. I'm trying to find a good picture right here. Okay, perfect. This is a good picture. So this child is obviously a little bit older than 6 months, but this is a picture that we're thinking about. So you can see that they're in the back seat and they are facing the back. That's what rear facing means. They're facing the back and they're also in the back seat. And again, this is to prevent that airbag from sort of, if it does implode or if it does explode, we want it to prevent injury to the infant, okay? And how long do they need to be rear facing and back seat? How long, at what age do they need to be in the rear? So at least, and it really is a measurement oftentimes of weight and height. So there is a maximum height or weight that is actually is the car manufacturers, but of course we have the AAP, the American Academy of Pediatrics, sort of setting and saying, okay, this is what the rule should be, and this is what. So generally, we want them to be in a rear-facing car seat until they're at least 1 to 3 years old. Rear-facing is recommended. And any child under the age of 1 should always be most definitely rear facing, and any infant only seat. So it really is a measurement. If the child outgrows the infant only seats, they can be front facing, but they still need to be in the back. They can be facing the front, but they still need to be in the back, not the front. But definitely an infant is going to be rear facing and the back seat. So the correct answer is going to be D. Okay, let's talk about temperature regulation in your infant. So if you're looking at temperature regulation, remember, we don't want to overheat these infants, okay? We want to make sure that they are properly clothed, meaning not too hot and not too warm. And we don't want to overdress them because that can overheat them. And remember, infants have very poor temperature regulation. They're not really able to regulate their temperature, especially because number one, they have no shivering mechanism as well. So in infants, they don't have the ability to kind of temperature regulate by using the process shivering, right? That's when we go on the cold, we're shivering to sort of make sure that it produces heat. And that doesn't happen in your infants. That's the reason why we want to make sure that we keep them away from drafty areas, that we are putting on proper clothing, especially when it's cold, to prevent that heat loss from happening as well. Okay? And again, this is the reason why we don't leave infants in, locked in the car. We don't leave them inside of the car just to prevent things like that from happening. Remember, infants and newborns have a lot of brown fat. Brown fat is the biggest thing that they have, and that usually is really around the chest area. It usually is around their upper back, shoulders, and this is really going to make about 5% of their body weight. Okay, 5% of their body weight, and what this is going to do is that it's going to be broken down to create or generate heat, and that's the basic thing that they have to prevent against hypothermia, that brown fat. Okay, that's temperature regulation. Remember, you might also hear the terminology convection, conduction, evaporation, all those terms, okay? Those are referring to the fact that these are the ways that heat can be taken away from the infant, and how do we prevent that, right? So a couple of different things that you might see is, just to add on to that factor about heat loss, is that, as soon as they take a bath, we wipe them down real good, dry them up quickly, because they can have evaporative heat loss, okay? Don't place them on things like if you're doing an assessment on the infant, right? Don't put them on a cold table, right? Put them in an area that's a little bit more warm, because that can lead to heat loss. Wrap them up, keep them away from drafty areas, all those sorts of things that we're looking at as well. Okay, here's another question that we're looking at. This is about a 3-week-old is exclusively breastfed. What will you include in the patient education to the mother during this clinic visit? Okay, so this is a 3-week-old, so they're not even 1 month yet. So what are you going to be looking at some of the things that you might tell this mom is do some patient education on. Again, I'm going to go ahead and give you guys a couple of seconds to take a look at this and come up with the right answer. Okay, 8, introduce solid foods around 3 to 4 months of age along with breastfeeding. So as far as your knowledge, right, do you think we should be introducing solid foods at 3 to 4 months? No, solid foods are going to be introduced at the 6-month period. So this is too early for them to give them solid foods. Okay, the infant needs to be supplemented with vitamin D daily. Okay, do you think this infant needs to be supplemented with vitamin D daily? Here, we're going to come back to that. C, cow's milk may be substituted for breast milk around 6 months. No, we know that cow's milk is going to be given 1 year and after. Breastfeeding is only recommended for the first 4 months of life. That is not true, okay? There's really no recommendation on how long you can really breastfeed. It really is dependent on the mom and the child, but really we usually say average is about 2 years, but sometimes it can be a little bit longer. Okay, so that's sort of some things that we're looking at as well. So based on the process of elimination, this is I'm going to eliminate answer option D because it's what I would consider more of an absolute statement. Answer option D. So I'm going to eliminate it because it's only recommended for the first 4 months of life. Okay, so that's going to be taken out, and I know that C and A are absolutely incorrect, which actually leads me to look at B. The infant needs to be supplemented with vitamin D daily. So remember the question here, you want to go back to the question. If you ever get confused, you want to look out for those words that are more absolute. What they say, this is like absolute only. So this word right here, the 3-week-old infant is exclusively breastfed. Exclusively means that they're only, meaning that the mom is very strict about only breastfeeding them. They're not getting anything else. So if they're not getting anything else, that usually means that they might be deficient maybe in some areas. So that's the reason why we are going to do vitamin D. And remember, breast milk alone does not provide enough vitamin D, and that can be concerning. Okay, that can be concerning in many ways. So that's the answer. So answer option B, the infant needs to be supplemented with vitamin D daily, is going to be the correct answer for this question. Okay, here's another one. You are providing care to a 1-month-old who is hospitalized. The patients are unable to be at the bedside. The infant is crying. Select appropriate nursing interventions for this infant. So remember, 1-month-old hospitalized, very concerning, right? Patients are not to be able to be at the bedside all the time. The infant is crying. Select appropriate nursing interventions for this infant. So here is what we look at as age-appropriate things, age-appropriate toys, age-appropriate play, all these different categories that we're looking at. So if you look on here, again, select all that apply. Question, I know this one doesn't specify, and that's unfortunately an error on the question part. Okay, let's look at answer option A. Let the infant Play with crib mobiles. Okay, 1 month old, let the infant play with crib mobiles. Is that something that's appropriate or not appropriate? So they're crying. Okay, remember, we have to focus on the fact that this is not just your regular 1 month old that's just, they're laying, in a prone position, they're crying. Okay, so we are looking at soothing measures, things that will soothe them. Okay, so if you let the infant play with crib mobiles, you're thinking maybe they get distracted. But remember, their parents are not there, their primary caregivers are not there, and playing with crib mobiles is not going to be soothing for this infant. It's a play activity that they might be able to do when they're not in distress, but this is a distressed infant. B, swaddle the infant. Yes, that sounds about right. Remember, swaddling. And remember, if there's students out there that are not familiar with swaddling or what that looks like, it's usually when you wrap that baby up. Okay, that swaddling the infant is a very comfort measure when they're in that tight spot. It sort of replicates or stimulates what it feels like to be in utero. Okay, when they're swaddled up tightly like that. So this is swaddling the infant. Okay, C, attempt to play peekaboo with the infant. This is an age appropriate game, but remember, is this appropriate when the infant is crying? No. Okay, and D, rock the infant. Yes, rocking is, again, a soothing mechanism. It's to calm them down. So you also want to look at what will go ahead and calm the infant down and what will stimulate them more. You want to look at things that are more comic, swaddling, rocking, okay, sort of maybe singing a little lullaby. So all those different things, okay. E, distract the infant with a toy. So distracting the infant with a toy, again, more so soothing mechanisms that you're looking at rather than things that will cause them to become a little bit more stimulated. It's a very tricky question here, but the correct answer is going to be B, which is going to be swaddle the infant, and B, rock the infant. Okay, and that's going to soothe them a little bit more. They need comfort at this time. It's sort of like when you think about adults, right? Just because I'm able to bicycle or be able to play a video game doesn't mean that when I'm sad, I'm going to sit there and play a video game. I might not have the concentrated ability to do that. So same thing. Want to look at what's soothing and what's versus compared to what's calming. Okay, here's your next question. You're assessing a 2-month-old infant. Which finding is a normal milestone that should be reached by this infant at this age? A normal milestone. So remember, going back to our milestones here, 2-month-old infant, what can they do and what can they not do? So I'm going to give you guys all a minute just to look at the answers or to look at the answer options and let me know what the answer is. A normal milestone. Okay, let's look at the first answer option. The infant can sit up with support. So at 2 months old, remember, they are just learning to have head control. They're learning to turn their head from side to side. This is not the age appropriate time for them to be able to sit up with support. Okay, and what age, so going back here, sitting without support, usually that's by 7 to 9 months. So sitting with support is going to be a little bit before that, maybe at the 6-month mark. Because remember, at 4 to 5 months, they're learning how to roll over side to side. The infant holds a rattle, okay? A 2-month-old infant, again, they may not be able to voluntarily reach for things. They may be able to kind of do basic things like look at a mobile, maybe swat at the mobile that's hanging off, but they're not able to sort of hold things that firmly yet, okay? See, the infant smiles at its parent. Now, that's something that a 2-month-old, remember a 2-month-old, if we go back here, they're able to coo and they're able to sort of mimic the actions or not mimic, I would say, but they're able to look at the caregiver. They're able to sort of get a kick out of, okay, they're smiling, or they're able to do more of those emotive actions at that point as well, the 2-month-old. D, the infant is afraid of strangers. Not really, okay? Stranger anxiety usually starts about 5 to 6 months. It's very intense, about 7 to 2 months. Usually at the 2-month-old, they really don't recognize who's taking care of them. As long as it's comforting, it's soothing, and they get those comfort measures, they could care less. But usually 5 to 6 months is when they start recognizing, oh, that's a familiar face versus, oh, maybe this is not such a familiar face that we're looking at in terms of that. So this is what you're looking at with your answer here. The answer is going to be the infant smiles at its parent. Okay, so they're able to, and again, now you might be asking, well, how do they know it's the parent? Or how do they not know it's a stranger? So in the question, it does say parent, but usually you're assuming that they're able to, it's looking more at the action rather than who's picking them. So it doesn't necessarily have to be the parent, but it could be anybody that picks them and they could be smiling too as well, as long as they're not in distress, of course. So that's the answer. Answer option C is the correct answer for this 2-month-old infant that we're looking at. Okay, next one, and this is one of those bigger things that we're going to be looking at. You're teaching a new mom of a 1-week-old infant on how to prevent SIDS, sudden infant death syndrome. Which statement by the parent requires you to re-educate the parent on this topic? Okay, you're teaching a new mom of a 1-week-old infant on how to prevent SIDS, sudden infant death syndrome. Which statement by the parent requires you to re-educate the parent on this topic? A, the best sleeping position for the baby is on their side or tummy. B, it's okay to share the same room with the baby. C, I will stop swaddling the baby once he can roll over onto his tummy. D, I will be sure to remove extra blankets and toys from the baby's bed. So this is focusing specifically on one main topic, which is your SIDS, your sudden infant death syndrome. And it says, which statement by the parent requires you to re-educate the parent on this topic? And we're going to briefly talk about sudden infant death syndrome, next category. So I'm actually going to go back on this question. I'm going to come back to this. Let's talk about SIDS first. So SIDS is sudden infant death syndrome, right? Risk factors, and this is what you need to focus on, those risk factors and what not to do. What are interventions that you should not be doing? Okay, so if you look at risk factors, remember prone positioning, okay, is a risk factor, especially if the child does not have the ability to roll over. Okay, you do not want to leave them in a prone position because what happens is that the airway can get obstructed. So if you leave them in a prone position with their face down, such as this, remember prone, supine, prone is this. They can cut off because they're not able to turn their head to the side or turn their body to the side. Their oxygen supply can get cut off with their nose and mouth getting smushed. So that's the risk factor that we have. Unattended, right? Prone positioning, tummy time, that's unattended. Tummy time is okay, but unattended, not okay. Exposure to tobacco smoke. So in a lot of households where you have a lot of smoking going on, this is and increases the risk factor of sudden infant death syndrome as well. Boys in general have a higher risk for SIDS rather than females, and having a low birth weight also increases your risk of SIDS. Now, other things that are what I would consider more, so gender is obviously something that's non-modifiable. I cannot change that, right? Or sometimes even low birth weight, that's sort of a more non-modifiable thing. Interventions that are more modifiable are going to be things that I have that are in my control. So if you have mattresses that are very soft, that sort of, kind of depressed, you don't want that. You want mattresses to be firm, and you don't want to leave anything to crib. No plastics, no plastic bags, no sheets, no stuffed animals, no soft toys, no soft bedding. Okay, that area should be very much clean. Okay, baby can be swaddled, but you don't leave anything in the crib. Okay, do not co-sleep. Okay, co-sleeping is probably one of the biggest risk factors. And then, of course, breastfeeding can actually decrease the risk of SIDS per a lot of research that's been done. So these are some interventions that you want to be concerned about. SIDS, I am guaranteeing you will be a test question on NCLEX. I would put a star next to this and say focus on SIDS on NCLEX or ATI or HESI. But they generally like to test a lot more on things such as these big main ideas right here. Okay, here is a food-related question. You are helping you know what, let's actually go back. We can answer this question right here. So which statement by the parent requires you to re-educate the parent on this topic? The best sleeping position for the baby is on their side or tummy. Is that true? Absolutely not. They should not be sleeping on their side or tummy. It's okay to share the same room with the baby. So is it okay to share the same room? It's talking about sharing the same room, not the same bed, but is it okay to share the same room? Maybe. We'll come back to that. Okay. C, I'll stop swaddling the baby once he can roll over onto his tummy. So that is, again, you're looking at, again, so when we looked at this question, remember, we're also looking at what to re-educate them on. So we're trying to re-educate them on some things. So I will stop swaddling the baby once he can roll over onto his tummy. Do you think that would be appropriate? Sure. I mean, you don't really need to swaddle the baby if they're able to roll over onto their tummy. I will be sure to remove extra blankets and toys from the baby's bed. Yes, that's something that you want to do. And then it's okay to share the same room with the baby. So going back to that, yes, that is okay. Remember, it's okay to share the same room as long as you're not sharing the same bed. That's fine. Now, this does ask about education and re-education. So remember that it's asking about things that the parent is doing wrong that you want to educate them on. So when you read these questions, even right now, I almost slipped off the fact that this was a re-education question. I looked at it and I said, hey, let me look for answers that are correct, or let me look for answers that are appropriate. So they are asking you to look for an answer that is not correct, okay, that you need to re-educate them on. So when you look at this one, it's okay to share the same room with the baby. That's okay, as long as you're not sharing the same bed, that's fine. The best sleeping position for the baby is on their side or tummy. That is incorrect. Remember, we don't want them to sleep their side or tummy because of SIDS. So that requires you to re-educate the parent on this topic. So that's exactly what you want to do. Okay, so A is going to be the correct answer for this SIDS, for the sudden infant death syndrome question. This is going to be A because that's an education point that you want to re-educate them on. All right. Okay, we talked about SIDS. Again, put a gold star right there. You need to go back and review SIDS. Let's look at a food question. So plenty of questions here, which I do encourage you to do in between so you don't get too bored with just the concept stuff that we're talking, and you can have a better idea and sort of apply what you learn, right? You're helping develop a meal plan for a 10-month-old. Which foods will you select to be part of the meal plan? Select all that apply. A, mashed potatoes. B, grapes. C, soup. D, toast with honey. So which foods will you select to be part of the meal plan? And you can do a select. This is a select all that apply question, right? So you can pick more than one answer option. So let's look at it. So would you want to give them, do you think mashed potatoes would be okay, right? Mashed potatoes would be okay to give? Absolutely. Okay, mashed potatoes would be okay and appropriate to give this up. What about grapes? So probably not. And I remember I did tell you like chopped up grapes are okay, but you have to assume when they say grapes, they're talking about whole grapes. Unless they specify that it's mashed up, then it might be okay. But usually if it says grapes, you're assuming it's whole grapes, and that would be a no-no. Soup would be okay to give, right? Something a little bit more, if there's vegetables, they're usually much more topped up, or it can be more creamy texture where you don't have solid stuff in there too. Soup would be okay. Toast with honey, right? Probably not, because remember we said no honey before the age of 1 to prevent botulinum toxicity. So answers are going to be A and C. So those are going to be the correct answers. Mashed potatoes and there's soup. It would be appropriate in this case scenario. Okay, let's move on to this Erikson's stages of Erikson's psychosocial stages. And then I'm going to backtrack once we get to Erikson's psychosocial stages. Actually, I'm going to go ahead and stop right here since we covered that part. And then I'm going to come back on the Erikson's. That might be a lot more information than what we need today. Right. Let's go ahead and pause right here.